Now, this is a tutorial on interstitial nephritis. Now, you need to know that what in interstitial nephritis, here you mostly have the involvement of the interstitium. In interstitial nephritis, you have the involvement of the interstitium, and you need to know that generally this is the kidney. So let's say that generally you have the kidney as such. So you are going to have renal blood that is going to perfuse. Generally, the interstitial at the first part you have the cortex of the kidney. The cortex of the kidney is going to be much more made of the nephron, while the medulla of the kidney is going to be much more pink, and in that medulla you have now the interstitium before you have the pelvis of the kidney, with the calyx and all the renal calyx and all that. So this is the interstitium of the kidney. Now, generally, under the histology of the renal parenchyma or the renal interstitium, you need to know that you have fibroblasts. The first cell that we have there, we have fibroblasts, and the fibroblasts are example of cells that produce erythropoietin. Now, the second cells that we have there, we have white blood cells inside the renal parenchyma. The third cells that we have in the interstitium, we have the interstitial cells for reabsorption, for the counter current multiplier mechanism. We have counter current multiplier mechanism, which is very important in order to prevent nocturia, for the reabsorption of fluid, in order to prevent nocturia and in order to prevent polyuria in a patient. And then the next element is that after that we also have other cells, like, so we have said fibroblasts, said white blood cells, we have interstitial cells, so interstitial renal cells, for the counter current multiplier mechanism, and we have the endocrine cells, like the cells that are producing vitamin D, that are producing, manufacturing vitamin D3 inside the kidney. So those are the different types of cells that we need to know at the level of the kidney. Now, after seeing these three major types of cells, we need to understand the fact that what? So, we need to understand the fact that generally the pathogenesis under interstitial diseases, is one, it can be affecting the fibroblasts. When it affects the fibroblasts, is just when we have fibrosis at the level of the kidney. And fibrosis at the level of the kidney can be visualized with ultrasound, where on ultrasound we are going to see what? An absence in differentiation of the cortex and the medulla. When we have absence in differentiation of the cortex and the medulla, it is now called of the cortex and the corticomedullary junction. It means that you have already fibrosis. Another element for fibrosis on ultrasound is that what? You have right kidney. And another element of fibrosis on ultrasound is that we have small size kidney. So those are the three major elements, and these are particularly occurring in the case of chronic kidney disease. Now, this is why on this diagram I've told you that the cortex was usually hyperechogenic, the medulla was echogenic, and then the renal pelvis is hypoechogenic, or darkish. It means that what? If you have a cortomedullary junction, absence of differentiation of the cortomedullary junction, it means that you can almost see this line, the difference between the echogenic and the hyperechogenic from the cortex and the medulla. And in this case of fibrosis also, all this kidney is going to become whitish. The kidney is also going to become whitish. And then the last one is that we are going to have the kidney size going to be small because of most fibrosis, and usually that occurs from age and occurs associated with chronic kidney disease. Now, the next element can be white blood cell proliferation. Is it clear? Now, we need to know that what the kidney function also, we have also white blood cell part inside the kidney. So you need to know that what anything that can also affect the interstitial part of the kidney can be associated with a proliferation of the white blood cells. Is it clear? Proliferation of the white blood cells, like in the cases of lymphoma. Is it clear? When you have a lymphoma, it may also present with an interstitial nephritis because those white blood cells are going to accumulate at the level of the interstitium of the kidney. Are you understanding? Now, the next point, you can have also proliferations like leukemias. Though leukemias is rare that it proliferates at the level of the kidney, but it can also proliferate at the level of the kidney. Then we have multiple myeloma. Is it clear? Multiple myeloma has two major pathologies inside. Multiple myeloma. Multiple myeloma has two major pathologies inside. The first pathology is that it's associated with increased white blood cell proliferation, and then the second problem in the pathology is that you are going to have increased production of light chains antibodies. Is it clear? Increased production of light chain antibodies. Now, for the increased proliferation of the white blood cell, is going to affect the kidney as a result of the interstitial nephritis. Is it clear? It's going to affect the kidney as a result of interstitial nephritis. Why? As from the increase in light chain antibodies, I've already told you in the previous tutorial that antibodies affecting the kidney is going to affect the kidney by a mechanism of a glomerulonephritis. Is it clear? Glomerulonephritis affecting the kidney as a result of the glomerulonephritis. Is it clear? So those are the two major pathogenesis via which you can have interstitial nephritis from the white blood cells, from the multiple myeloma. Sorry. Now, the next point, you need to know that what the white blood cells can the interstitium can also be affected when you have toxins. Is it clear? Generally, toxins can also result to the affection of the interstitium, but yeah, the toxins that are going to be affecting the interstitium are the toxins that are non-filtrated or unfiltrable. Is it clear? They are not filtrated. So we have said that the toxins which are filtrated are the ones that are going to affect the tubules, but the toxins which are not filtrated are the ones that are instead going to affect the interstitium. Is it clear? So now, in case of the toxins that are filtrated, is it clear? So the extrinsic toxins that are not filtrated, generally we have elements like, so when you take you have toxic products. Is it clear? Like grass, there are certain grass, herb, or phytotherapy which can result to a kidney damage via this mechanism. Is it clear? Because there are certain phytotherapy products that cannot be reabsorbed, that cannot be filtrated, but are still being taken by patients. Is it clear? And they are going to result to extrinsic toxicity of the renal interstitium. And then we have intrinsic product that can also result to toxicity at the level of the interstitium. And those intrinsic products, we have what is called uric acid. Is it clear? Now, you are going to ask me the question that uric acid is both in the case of tubular damage and the case of interstitial damage. I will say yes. Is it clear? Uric acid is both in the case of tubular damage and interstitial damage, because you have two main types of uric acid the damage. Is it clear? It can either be a urate nephropathy. Is it clear? It can be urate nephropathy, or it can be uric acid nephropathy. Is it clear? Urate nephropathy is going to result to a tubular damage. Is it clear? While a uric acid nephropathy is going to result to an interstitial damage, and they are two different elements. Is it clear? Now, tubular nephropathy generally results to a tubular damage because what you need to know that what it is the ions that are dissolving in water. Is it clear? And uric acid is because it is more of the uric acid that does not dissolve, of the acid part that does not dissolve in water. So let's take an example. In hydrochloric acid, it is the chloride ion that is going to dissolve in water. In ethanoic acid, it is the ethanoic ion that dissolves in the water. And similarly, in uric acid, it is the urate that dissolves in water, and that is what is going to result with tubular damage. Why uric acid nephropathy is what results to interstitial damage. Thank you.